Hello everyone, welcome to my YouTube channel. Today let us learn about biology for engineers. The topic we are going to discuss today is human heart. So the contents we discuss today are introduction to human heart, diseases of heart with engineering solutions. In that we are going to learn about coronary heart disease and heart failure. So let us learn about introduction to human heart. So heart is the most important part of our body where it pumps blood from heart to other parts of the body and also receives a purified blood from the lungs, which is called as double circulation. The human heart is a vital organ responsible for pumping blood throughout the body, supplying oxygen and nutrients to various tissues and organs. It is a muscular organ located in the chest cavity slightly to the left of the sternum, that is breastbone, called as mediastinum. This organ pumps blood through the blood vessels of circulatory system. The pumped blood carries oxygen and nutrients to the body while carrying metabolic waste such as carbon dioxide to the lungs. In humans, the heart is approximately size of the closed fist. So let us learn about diseases of heart and with engineering solutions. So the first disease we are going to study today is coronary artery disease, that is CA. So this is the representation of CAD. Coronary artery is filled with pure red blood cell. After the disease occurred, it has a deposit of plaque that is called as cholesterol deposit, which blocks the pumping of blood. CAD is the condition where coronary arteries that supply blood to the heart become narrowed or blocked due to buildup of plaque, that is atherosclerosis. Engineering solution for CAD is angioplasty. What is angioplasty? It is a procedure used to open blocked coronary arteries caused by the coronary artery disease. It restores blood flow to the heart muscle without open heart surgery. So next is, during this procedure, a tiny balloon catheter with a stent is inserted into the blocked artery. What is a balloon catheter? A tiny balloon catheter. A tiny balloon catheter is a soft catheter where its tip, which is used during the catheterization procedure to enlarge a narrow opening or a passage within the body. A stent. What is stent? A stent is a mesh-like structure which is inserted in the hole of the passage. The balloon is inflated to widen the artery and a stent is left in the place to keep the artery open. So, let us know about causes and risk factors of CAD. The buildup of plaque in the arteries is the primary cause of CH. What is CH? Coronary heart disease. Plaque is made up of cholesterol, fat, calcium, and other substances. Risk factors that contribute to the development of CH3 include high BP, that is hypertension, high cholesterol level, hypercholesterolemia, smoking, physical inactivity, obesity or overweight, diabetes, that is sugar, family history of heart disease. If any family members before the children has any heart problems, it is transferred to the next generation of the family. Age. Risk increases with age. Gender. Men are at higher risk than premenopausal women. So let us learn about symptoms of CAD. CHD may not cause noticeable symptoms in its early stage. As the disease progresses, common symptoms may include chest pain or discomfort, that is angina, that may radiate to the left arm, back, neck, or jaw. Shortness of breath. The people suffering from CAD has problem of breathing. Fatigue or weakness. They causes tiredness, nausea or dizziness. The diagnosis for CAD is, diagnosis of CHD involves the combination of patient history, physical examination, and diagnostic tests. Common tests include electrocardiogram (ECG or EKG) to measure the heart's electrical activity, stress tests to evaluate the heart's response to exercise, coronary angiography to visualize the coronary arteries and identify the blockage of heart, cardiac CT scans or MRI scans to obtain detailed images of the heart and blockages of CAD. that is coronary artery. So let us learn about treatment and management. The treatment of CHD aims to reduce symptoms, prevent complications, and improve overall heart health. Common treatment options include lifestyle modifications, adopting a healthy lifestyle by quitting smoking, engaging in regular physical activity, maintaining a balanced diet, and managing weight and stress. You have to manage weight and you have to lower the stress levels, and the regular physical exercises are required for treatment of CAD. So, medications, prescribing medications to control blood pressure, lower cholesterol levels, reduce blood clotting, and manage other risk factors. Angioplasty and stenting. In cases of significant blockages, percutaneous coronary intervention (PCI) may be performed. A balloon catheter is used to widen the narrowed artery, and the stent is placed to keep the artery open. That is angioplasty, as I said before in the introduction of CAD. Coronary artery bypass grafting (CABG). In severe cases, CABG surgery may be performed to bypass the blocked coronary arteries using grafts from other blood vessels. The second disease we are going to study today is heart failure. This is the representation of heart failure where it blocks the artery and damages the muscle. Heart failure occurs when the heart is unable to pump blood efficiently. The engineering solution for heart failure is LVADs, that is left ventricular assist devices. It is a pump that we use for patients who have reached end stage of the heart failure. The doctors implant the LVAD, a battery operated mechanical pump which then helps the left ventricle pump blood to the rest of the body. So LVADs are mechanical pumps used to support the failing heart. LVADs are implanted to assist the heart in pumping blood, improving the overall heart function and quality of life for the patient. So let us learn about causes of heart failure. Heart failure can result from various underlying conditions that weaken or damage the heart muscle. Common causes include coronary artery disease (CAD) and heart attacks, high blood pressure hypertension, cardiomyopathy, weakening of the heart muscle, heart valve diseases, congenital heart defects, arrhythmias, irregular heart rhythms, chronic lung diseases, diabetes, obesity, excessive alcohol or drug use. So, let us learn about symptoms of heart failure. The symptoms of heart failure can vary depending on the type and severity of the condition. Common symptoms include shortness of breath, that is dyspnea, during physical activity or at rest, fatigue, and weakness, swelling in the legs, ankles, and abdomen, rapid or irregular heartbeat, persistent cough or wheezing, reduced ability to exercise, sudden weight gain due to the fluid retention. So let us learn about diagnosis of heart attack. Common tests include echocardiogram to assess heart structure and function, electrocardiogram (ECG or EKG) to measure the heart's electrical activity, chest X-ray to check for signs of congestion in the lungs, blood tests to evaluate kidney and liver function, as well as levels of certain hormones. So let us learn about treatment and management of heart failure. The treatment of heart failure aims to improve symptoms, slow disease progression, and enhance the patient's quality of life. Treatment may include medications to control blood pressure, reduce fluid retention, and improve heart function. Lifestyle modifications such as following a low sodium diet, exercising regularly, quitting smoking, and managing stress. Cardiac rehabilitation programs to help patients with exercise and lifestyle changes. Implantable devices like pacemakers and defibrillators to regulate heart rhythms and support heart function. In severe cases, heart transplantation of left ventricular assist devices may be considered. So thank you everyone. Please do watch whole video, like, share and subscribe my channel. Thank you everyone.